Hey everyone, welcome back to the channel. I'm really glad you're here today. Now, I know this topic might make some of you squirm just a little, but trust me, it's super important and totally worth talking about. We're going to dive into something that doesn't get enough spotlight, but can actually tell us a lot about a guy's health: the size of your testicles. I mean, we don't often chat about this in everyday life, right? But these little guys have a big story to tell, from fertility and hormone levels to warning signs about serious medical issues. So if you've ever wondered, is my testicle size normal? Or should I be worried about changes? This video is exactly for you. I'm going to break down the science in a clear, no-judgment way and help you understand what your body might be trying to say. Plus, I'll share some practical tips on how you can keep track of your testicular health at home, because knowing this could literally save your life. So, stick around and let's get into it. And hey, don't forget to like and subscribe if you want more straightforward health talks like this. Alright, let's jump right in. What can the size of your testicle tell you? Find out now. Section 1. Introduction to testicle size. First, let's start with the basics. What is a normal testicle size? On average, adult male testicles measure about 4 to 5 centimeters in length. That's roughly 1.5 to 2 inches, and about 2.5 centimeters in width, nearly an inch across. To give you a relatable size comparison, imagine a large olive or a walnut. However, just like your hands or feet, testicle size can naturally vary quite a bit from person to person. Size matters because it can act as an early signal about your health. When there are noticeable changes or significant differences between your testicles, it might indicate issues related to hormonal balance, fertility, or even underlying infections or cancer. So, while size alone isn't the full story, it definitely helps us get clues about your health status. Section 2. What testicle size reveals about fertility now? One of the most important aspects testicle size can indicate is your fertility potential. Inside the testicles are millions of tiny structures called seminiferous tubules. This is where sperm is actually produced. Generally, larger testicles have more seminiferous tubules, meaning they have a greater capacity to produce sperm. So, if your testicles are on the larger side, you might have a higher sperm count, which can be good news for fertility. On the other hand, smaller testicles can sometimes be associated with lower sperm production, or conditions like Klinefelter syndrome or varicocele, which may reduce fertility. But don't worry or jump to conclusions just because your testicles seem smaller. Fertility depends on many other factors too, including sperm quality, motility, your overall hormone levels, and general health habits. Section 3. Testicle size and hormonal health. Testicle size can also give insight into your body's hormonal health, particularly your levels of testosterone, the primary male hormone responsible for muscle growth, energy, libido, and even mood regulation. Men with smaller than average testicles might produce lower testosterone levels, which can lead to symptoms like fatigue, decreased sex drive, loss of muscle mass, and sometimes even depression or irritability. If you notice these symptoms along with concerns about your testicle size, it's a good idea to consult a healthcare professional for a hormonal evaluation. Blood tests can measure testosterone and other important hormones, helping you find out if treatment or lifestyle changes might be beneficial. Section 4. When to be concerned about testicle size changes. Here's where it gets crucial. Sudden or noticeable changes in the size of one or both testicles warrant attention. Some common causes of testicle size changes include testicular atrophy. This is when a testicle shrinks, which can happen because of aging, trauma, or conditions like a varicocele, enlarged veins inside the scrotum that affect blood flow. Infections. Conditions such as epididymitis or orchitis cause swelling and sometimes pain due to bacterial or viral infections. Testicular torsion. This is a medical emergency where the spermatic cord twists, cutting off blood supply, causing sudden, severe pain and swelling. Immediate surgery is needed. Tumors or cancer. Abnormal growths or lumps can make a testicle feel larger or harder, which must be evaluated quickly. If you experience any of these warning signs, like pain, lumps, or rapid size changes, please seek medical attention immediately. Early diagnosis can be life-saving. Section 5. Causes of testicle size variation besides medical conditions. Testicle size can be influenced by several other factors, including age. Testicles often shrink slightly as men get older. This is a natural part of aging lifestyle. Excessive alcohol intake, anabolic steroids, or drug abuse can negatively affect testicle size and function by disrupting hormone production. Genetics, just like height or eye color. Some men naturally have smaller or larger testicles without any health implications. Medical treatments, chemotherapy, radiation, or surgery for other conditions can sometimes cause testicular shrinkage or damage. Understanding these factors helps you differentiate between normal variation and something that might require medical attention. Section 6. How to check your testicle size at home now. Let's talk about how you can check your testicle size safely at home. It's called a testicular self-exam, and it's a simple, yet powerful way to stay on top of your health. Here's how to do it. Choose the right time. After a warm shower or bath is best because the scrotum is relaxed and easier. To examine, gently hold your testicle between your thumb and fingers. It should feel smooth and firm, but not hard or painful. Compare both testicles for size, shape, and texture. Remember, it's normal for one to be slightly larger or hang lower than the other. Feel for any lumps, bumps, or irregularities. These can feel like small peas or harder spots. Note any pain or tenderness during the exam. If you notice anything unusual, lumps, hard areas, or a change in size or texture over time, make an appointment with your healthcare provider. Early detection is key for many testicular conditions, including cancer. Regular can help you become more familiar with your body, so you'll know quickly if something changes. Make it a monthly habit, just like checking your skin for moles. Section 7. Final thoughts and encouragement. So, what exactly can the size of your testicle tell you? Well, it's more than just a number or a measurement. It's a window into your body's overall reproductive health, hormone balance, and sometimes even signs of serious medical conditions. But here's the most important takeaway. Size alone doesn't tell the whole story. What really matters is being aware of your own body, noticing any changes, and taking action if something feels off. Your health is your most valuable asset, and understanding your body better is a powerful step towards protecting it. By staying informed and proactive, you can catch potential problems early, improve your fertility and hormone health, and ultimately live a stronger, more vibrant life. If you found today's video helpful, please hit that like button, subscribe if you haven't already, and share this video with friends or family who might benefit from this important information. Remember, sometimes a simple conversation can make a huge difference, and I'd love to hear from you. Drop a comment below with any questions you have, or tell me what health topics you want us to explore next. Your feedback helps me create content that really matters to you. Thanks so much for watching, and for taking the time to look after yourself. Until next time, stay healthy, stay curious, and take good care of you.